especially for public places such as canteens, schools, and wet markets. It has a very high degree of population flow. We have to make sure that all these people could be managed, and also we can check their temperature and the health code. And also, if for people who have been to places which confirmed cases had visited, or if people who have received the pop-up window in their health code, these people have to report to their local communities and the neighbor committee. Right now, we are attaching great importance to the epidemic-related schools. And we have to make sure that for those people who have been lived with the students who have visiting those above-mentioned schools, when we are transferring the teachers and the students, we have to conduct the online classes. Especially for graduate class, we have to provide more psychological counseling and the online education to the students. Start from today to the end of this month, Beijing will roll out 3 rounds of nucleic acid testing to 11 districts in Beijing. Here, I would like to call on all the local residents to cooperate with us and make sure that you avoid gathering when we are queuing for the nucleic acid testing. Make sure you keep your hands clean. Before you receive your NAT results, make sure you avoid gathering and do not come to different communities. Make sure you don't leave Beijing at this critical time. Today, with us today, we have Mr. Zhao Weidong, the Deputy Head from the Commerce Bureau of Beijing, and Deputy Head of Chaoyang District, Yang Beibei. And also, we have spokesperson from Fangshan, Mr. Lü Chenfei. And also, we have the Deputy Head of Shunyi District, Mr. Feng Jiangquan. And also, we are glad to have the Deputy Director of Beijing CDC, Madame Pang Xinhuo, with us. For all the guests today, they will brief us on the latest situation and address your questions. First, I would like to invite the Deputy Head of Beijing CDC, Madame Pang Xinhuo, to give us an update on the current situation in Beijing, and also he will release some information about the risk level in Beijing. Friends from the media, good afternoon. So right now, I would like to brief on the new local cases and also some of the health reminders. Start from 4 p.m. yesterday to 4 p.m. today, Beijing reported 22 new locally transmitted cases. 21 are confirmed cases, and also we have 1 asymptomatic cases, 9 in Chaoyang, 7 in Fangshan, and 2 in Shunyi, 2 in Fangshan, and also we have 1 in Xicheng and Yanqing. So for the case 209, 217, 221, all these people are students in the primary school, and these people lived in Chaoyang district. On April the 22, we also have these people identified as the close contact, and these people have been brought into collective quarantine. We have sent these people to designated hospital, and these people show mild symptoms. Case 210 live in the Doudian township of Fangshan district. He used to attend a wedding with another confirmed case. On 24th of the month, he received the nucleic acid testing and tested positive on 25th of April, and we already sent this person to designated hospital. And then he was confirmed as a COVID-19 infected cases with mild symptoms. Case 221 is a family member of case 114. So right now he's live in the Hoqiao village, Liqiao township of Shunyi district. So on April the 22nd, this person was brought into quarantine as a close contact, and later he was tested positive and later transferred into a designated hospital. And also he also showed up a very light symptom. Case 212. This person lived in Palm Spring apartment of Zhonglüquan and Liulitun district. So actually he is one of the close contact with another confirmed case. On April the 25th, this person was tested positive for the NAT, and later on this person was transferred to hospital for later treatment, and this person showed up light symptoms. Case 213 was the wife of case 185, so she lived in the same place as case 185 did. And on April the 25th, she was tested positive with NAT and was identified as the asymptomatic case. So for case 218, lived in the Beijing township of Changping district. He used to work with case 145 to do the construction for case 173. And on the 25th of the month, this person was tested positive of NAT. And also this person showed up light symptoms. Case 219 is the family member of case 149, live at the same place with 149. And she was brought under quarantine as a close contact on the 25th of the month. This person was tested positive, and on the 26th, this person was identified as the confirmed case with light symptoms. For case 220, also live in the Yuzhuang village of Doudian township of Fangshan district. This person used to attend a wedding where other confirmed cases present. On the 24th of the month, this person was tested positive and later transferred to designated hospital. And on the 26th of the month, this person was confirmed infection with light symptoms. For case 222, also live in the Yuzhuang village of Doudian township of Fangshan district. So she also one of the person who attending the wedding mentioned above. She was under quarantine because she was identified as the close contact. And on the 26th of the month, she was confirmed infected. So for case 224, also the wife with a previous infected patient. On April the 24th, she went to the quarantine site, and on the 25th of the month, she was tested positive, and on the 26th of the month, she was tested as a confirmed case with light symptoms. Case 224 live in the same apartment with case 145. On April the 22nd, this person was identified as a secondary close contact with case 140 and 141, and later he received multiple times of nucleic acid testing. However, from April the 24th, this person developed fever and coughing, and on the 25th of the month, this person tested positive and later transferred to hospital for further treatment, and he also showed up light symptoms. Case 225 live in the same place with case 158. And this person also work in Doudian township of the Fangshan district. As a close contact of case 158, this person was brought into quarantine. On the 25th of the month, this person reported positive for the NAT, and on the 26th, he was identified as a confirmed case. Case 226 live in Wayao village of Doudian township of Fangshan district. So earlier, this person went to the Dalian Huoshao restaurant with case 165 and case 167. As a close contact, this person has been brought into quarantine. He later developed coughing, And later with the nucleic acid testing, this person was confirmed as an infected patient with normal symptoms. Case 227 live in Doudian Town, Yuzhuang village of Fangshan district. So this person is a security guard. So as he is in the risky group on the 25th of the month, he received nucleic acid testing and showed positive in the results. On the 24th of the month, he was confirmed as a COVID-infected patient. Case 228. He lives in the Zhaoxingdian village of Changxingdian street of Fengtai district. So he is a close contact of case 186, and on the 24th of the month, he reported positive for the NAT and later transferred into a designated hospital. And this person developed light symptoms. Case 229 live in the Chaoyang town of Fangshan district. On the 21st of the month, he shared a public toilet with case 189. He said on the 24th of the month, he started to develop symptoms, and on the 26th of the month, he was tested positive with NAT with light symptoms. Case 230 is the wife of case 188, live in the same place with 188. He used to put into quarantine on the April the 23rd, and she said she started to develop symptoms on April the 24th, and on the 25th, this woman tested positive and later transferred into a designated hospital, and later she was confirmed with the infection. So for the CDC, have investigate and check all the 38 samples, and all of these people are infected with the Omicron variant. So for case 139 to 147, from the case 149 to 153, and 161 to 170, and 173 to 178, and 173 to 189. So all of these 38 patients, they are actually showing the same kind of gene sequencing. So they are the first generation of the virus. So according to the gene sequencing and the epidemiological investigation, we could come up with the preliminary conclusion that all the 36 infected cases, they share the same Omicron variant. So for the 38, so one specific case, actually it come up with a different transmission chain. So for case 186, because of the work conditions for this person used to have some contact with case 138, based on our analysis, we think because of the work exposure, case 186 getting infected. And also we try to find out some of the more risky regions. Because of that, later we will have more confirmed cases. So right now we could see for some of these cases, they are actually coming out from the same transmission chain, especially after we done the epidemiological investigation and the sequencing. We could see that we have two transmission chains. So the first transmission chain is from Chaoyang district, and the second one is coming from the Fengtai Hospital of Integrated Traditional Chinese and Western Medicine. Start from the 22nd of the month. Actually, the cases cover 8 districts, 5 in. Most of them are coming from Chaoyang, and we have 3 in Fengtai, 2 in Yanqing, 2 in Xicheng, and 1 in Tongzhou. Except for the transmission chain we have reported earlier, such as the schools and the tourist site and the family gathering. recently, we found another cluster that actually coming out from a wedding, and also it will cover 4 cases. So in the future, it will cause more infections. So right now, the current epidemic situation remains complicated. We are at a critical stage of the containment. We have to take immediate action in response to the surge of the COVID cases. We have to be decisive to exercise all the containment measures, especially for some of the high-risk groups. We need to take thorough screening and stringent containment measures to make sure that we can cut off the transmission chain. So this time, we could see we have some cluster outbreak in the restaurants and the wet markets, and also we have to put priority in the containment efforts in the rural areas. We also need these people to raise their awareness. For example, they should postpone some of the weddings, and they should try their best to avoid the gathering. They have to wear a mask and make sure there's a good ventilation in their rooms, and also they need to exercise a very safe social distance. Once again, I would like to call on all the residents to abide by the containment measures and also closely follow the information published by the authorities. So if for people who have been to places which confirmed cases have visited before, or if you have received a pop-up window from your personal household, make sure you report to your local community. So when you are receiving the nucleic acid testing, make sure that you protect yourself. If you develop some of the symptoms, for example, fever, coughing, you have to go to the hospital for further screening. And please do not buy medicines so that it may have a postponement or delay of your treatment. So everyone has the responsibilities to ensure the safety in Beijing. So that is my update about the new cases. So right now, I would like to update you on the current situation of the risk level. By 24-hour April the 26th, for the Chaoyang district, for 18里店 township, it has reported over 6 cases in the past 16 days. According to the risk standards for the COVID-19 in Beijing, start from today. So for the 18里店 township, the Zhoujiazhuang 19 courts will be upgraded to high-risk region from medium-risk region. And also, I would like to talk about Fangshan community, which is the number 20 courtyard of the 18里店 township, Nanmofang township, and the Panjiayuan Street, Doudian township. In the past 14 days, they reported over 2 cases. For Chaoyang district, for the Panjiayuan Street, the Fatou Street, the Fatou Xili community in the past 14 days. Also, they reported over 3 cases in the past 14 days. According to the risk standards for COVID-19 in Beijing, start from today, for the 7 places I just mentioned, they will become the mid-risk region. So right now, we have 2 high-risk regions, that is the Songyuli community of Panjiayuan Street of Chaoyang District, and also the 18里店 township, Zhoujiazhuang 19 compound. So these 2 places are confirmed as the high-risk region, and also we have 7 mid-risk regions, including the Songyun East community of Panjiayuan Street, Lishui Fangyuan community of Shenzhenfang Township, Nanxingyuan community of Nanmofang Township, and also the Wushengdongli community of the Panjiayuan Street, and also Yuzhuang village of Doudian Township of Fangshan district. So for these 7 places, are confirmed as the mid-risk regions. For the other parts of Beijing, they remain low risk. That is my update. Thank you. Now I would like to invite Deputy Head of Chaoyang District, Madam Yang Beibei, to brief us on the latest containment efforts in Chaoyang District. So, first of all, I would like to give you an update. So as of yesterday, we reported 9 new cases. So these people are already in the control area, and these people are with light symptoms. First, I would like to give you more details about these 9 cases. So this person have been visited the Chaoyang sample collection site, and also they visited the Huadu TCM hospital, Wanggui Fresh Market in Jingsong branch. Once again, these people visited the Huadu TCM hospital, and also they visited KFC in Songyuli branch. And also they are visiting a local restaurant in the Shuangjing Street. And also they are visiting some of the gas stations. And also visited the number 128, a hair salon in Shuangyu Nanli. And also they are visiting in the one of the compartments in the Dawang Street. And also this person visited a fever clinic of the Beijing Hospital of Integrated Traditional Chinese and Western Medicine. And also he visited again on the alcohol shop. On the 20th, visited the Nanchengxiang village. In late afternoon, went to a life plaza. And also visited one of the decoration store. A gas station from the Poly School, and also visiting a convenience store nearby. And in the evening, this person went past the Jianguo Street and also visit a beef noodle shop. So I would like to remind all the residents, if you have received some of the pop-up window from the health code, or you have been to places where I just mentioned, you could report to the local community. Second, I would like to update you on the settlement. So especially I would like to emphasize the NAT. So on the 25th, we started the first round of the testing. So for key areas, we also roll out mixed testing. So this time we have collected over 3.7 million samples. And also we identify certain third party to do the investigation and the testing. So for the mixed testing, all of them all show negative, and also we have another 5-to-1 mixing testing. One case show positive. So right now we are running another round of testing. And so today we are doing the second round of testing to students and the teachers in the middle schools. And tomorrow we will roll out the second round of nucleic acid testing to all the people who live and work in the Chaoyang district. We will set up temporary sample collection sites abide by the subways and the supermarkets to make sure that all the local residents can receive the test as soon as possible. And also we would like to bring more conveniences to people who work and study outside. At the same time, we open up green channel to the vulnerable groups. For those who are not able to get tested, we also have a far-reaching group, so they will go to their doorstep to collect the samples. Once again, I would like to remind people who are living in the restricted area, so do not go downstairs to receive the testing, because we want to reduce the cross-infection. So for people who are live in different areas, please follow the instructions of the local community and get tested. And also please follow the instructions on site. And when you are receiving the testing, make sure you exercise safe distance, and also do not talk to others, and make sure you keep your hands clean. After you finish the sample collection, put back your mask. Thank you for your cooperation again. So for Chaoyang district, we act in an immediate manner, and also have brought the people under quarantine as soon as possible, especially for the transmission chain come out from the Huguosi eatery. We are able to identify over 1,000 close contacts. So we will closely monitor the health conditions of these 1,400 people. At the same time, we will look at the NAT results from other districts. So, for example, for Panjiayuan Street, Wusheng East, there were several buildings or compounds may have potential risk of exposure of COVID. And also we are paying a lot of attention to the situation in the Shuangjing Street, Datun Street, and Xishili Street, Nanmofang Township, Guanzhuang Township, and the Shibalidian Township. We are paying some of the attention to the situation there, and also we are able to identify some places as the restricted area and the control areas. So for some people, they have to stay at home because literally we have to lock down some of the areas, and also we will bring services to their doorsteps. And also for Shuangjing Street, for Yucheng Shangyuan and Guanghe Nanli community and the surrounding restaurants. And for the number 1, 2, 3 compounds from the Nanmofang Township and Shuangnong Nanli community from Nanmofang Township, 2111 to 216, and several neighboring communities. And also we have to include the compound 209 of Zhoujiazhuang Street of the Shibalidian Township. These places will be identified as the restricted area as well. So for Hongshan community, we also put out some of the temporary lockdown areas. So we will not allow people to leave those lockdown areas. So in the future, we will continue to follow the results of the NAT to take more containment measures. Third, I would like to talk about the food supplies. So for Chaoyang district, we will mobilize more resources and do more replenishment, especially for the Carrefour, Hema Fresh, and other supermarkets. For some of the offline shops, they will extend their business hours. So they will close the shops until the last customer leave the store. And also we have to improve the capacity for the delivery. So we will mobilize more delivery men to help with the packaging and the delivery. And for some of the shopping applications, we will replenish more food, and also for the delivery service will end until 24 hours on the day. And at the same time, we will closely monitor the inventory of the meat, eggs, vegetable, and fruit. When necessary, we will make more replenishment. And for the supervision department of the municipality, will also check the price of some of the daily necessities. We will make sure that we will investigate and prosecute or punish some of the illegal behavior, for example, the illegal hogging and the price gouging. Fourth, for the Chaoyang district, we will try our best to serve the local residents. In the afternoon of April the 25th, we found several cases in the Huguosi eatery. We have put out the temporary lockdown to the risky areas. So we also have some officials to come to those places. So for the local officials, they become volunteers and also provide services to the vulnerable groups who have lived in those areas. For the local communities, and especially for the hospital institutions, they will also open to the public. And if some of the patients they need special service, they have to reach out to the community to get the medical treatments. And for the community supermarkets, we also arrange over 10 vehicles to transport some of the vegetables. So right now, the current epidemic situation remains complicated, and right now, we are at the critical stage of the containment. So for Chaoyang district, we will take immediate actions in response to the surge of COVID cases, and we will move along with the nucleic acid testing to make sure that we could curb the spread of the virus. In the end, I would like to say a big thank you to all the residents who have believed in Chaoyang district. We will try our best to address your needs and also to protect our city. Thank you. That is my update. Now I would like to give the floor to the Deputy Head of Fangshan District, Mr. Lu Chengfei, to brief us on the containment efforts from Fangshan. Friends from the media, good afternoon. So as of now, 7 cases reported in Fangshan District. I would like to give you more details. First, I would like to talk about the travel history. Case 11, man, 63 years old. So this person lived in the Doudian Township of Fangshan District, Yuzhuang Village. So on the 21st, he stayed at home. And in 22 and 23, he didn't go out. And case 12, female, also lived in the Yuzhuang Village of Doudian Township. So on the 20th, he used to take the bus 934 and also visited the Yuzhuang market of Doudian Market. And also she visited one of the BHG shops in the Yuzhuang Village. On the 22nd, she visited one of the subway stations in the Yuzhuang Village and also the nearby parking lot, and also visited one of the local supermarkets on the 22nd. On the 23rd, she went to the Yuzhuang Village Committee, and on the 23rd, she didn't go out. Case 13 and live in the Yuzhuang Village of Doudian Township. So used to dine in the Dalian Huoshao restaurant. On the 23rd, in the Yuzhuang Wet Market. Case 14, man, 60 years old, live in Huijing, community of Doudian Township of Fangshan District. On the 21st, she went to Shanshui Huihao community for work. and went to the Shanxi noodle shop on the 23rd and the 24th. She have followed the same pattern of the travel with the 21st of the month. Case 15, female, 45 years old, live in Xiaogaoshe village of the Doudian township of Fangshan district. On the 21st, she went to the BHG shop, also work in the Doudian township. And the day next, she went back to the BHG for shopping. On the 23rd of April, she went to a local restaurant in the Doudian township. Case 16, female, 68 years old, live in Yuzhuang village of Doudian township. On the 21st, 22, and 23, she didn't leave the village. And on the 24th, she used to shop at a local supermarket. And on the 25th, she didn't leave the place. So for the next case, I used to visit one of the local kindergarten of the Yuzhuang village and also use one of the public toilets in the village's committee. On the 22nd, he visited one of the local warehouses and the kindergarten, and also visit the BHG store for shopping on the same day. And on the 22nd, she visited one of the counter in Walmart. And also on the 23rd, she also visited one of the local shopping mall. And on the 24th, he visited one of the local park in the Yuzhuang village of Doudian township. On the 25th, he didn't leave his house, and on the 26th, he went to a fever clinic in the Yuzhuang village. According to the current investigation, for case 13, he used to dine with another confirmed cases in Dalian Huoxiao restaurant. And for case 15, used to went to the same restaurant in the past. For case 11, 12, 14, 16, for these 4 people, they are actually staying in the high-risk region in Fangshan district. So first, we have to attach great importance to the key places. So right now, we think for Dalian Huoxiao restaurant, it is the high-risk place in Fangshan district. For all the cases we found, they may more or less have some relations to people who have visited this restaurant. So we will do more screening in this restaurant. And right now,